the combination of Divansri and assistant flow and how they work together. Um, you mentioned, one very key aspect, which is any of our products, whether it's in allopathy or Ayurveda, any product in the world really does not work without a person taking lifestyle interventions, right? Eating the right food, working out, all of those things are important in combination with any sort of product or solution to really see long term change in a condition like PCOS. Um, but I wanted to understand how Divansri assistant flow kind of work together. Do they work together? Is there like a specific synergy between the two products? Um, are there similar herbs that are used in each product that kind of work together to create a holistic effect? How did you think about this combination therapy when you were approaching women with PCOS and menstrual irregularities?
Okay, so Divantri Flow was made specifically for women with menstrual irregularities with or without PCOS.
Got it.
And uh, it also takes care of other problems like leukorrhea and any kind of menstrual irregularities is what Divantri Flow helps in. So there are slight overlap in the herbs that are used in both the products. So that is why, like I said right in the beginning, we don't give Divantri Flow to patients who have regular periods. We give it only to those who do not have regular periods. Like PCOS patients, we've had patients who haven't had their periods for almost a year. 3-4 months is very common, and so in
That's
such
so
cases,
sad.
in such cases, it becomes important that we also ensure that the other parameters which are responsible for them to get normal periods are also taken into account.
Got
I
it.
mean, on one
Got it.
side we know they have a hormonal imbalance, but then this is more of a support system that will take care of other issues. I know also ensure that there are phytoestrogens in Divantri Flow, which will help these people get their regular periods.
Understood. Understood. So essentially, what you're saying is that these herbs, some of them may have some overlap, but they work together to kind of combat these specific issues at a holistic level, where one maybe focuses on this particular aspect of the hormonal ratio, this one will work on a different aspect of that to kind of work together to create a holistic effect. That's really incredible, and I think I mean, I appreciate it as someone in the field, but it's for those who aren't in the field, it's a really difficult thing to think through formulations, especially after studying the ancient texts and then contextualize that in the form of a medication combination that is so thorough and complete in its effects. Um, I think just two final questions. I don't want to take up too much more of your time, but post these clinical trials, what have you seen in terms of these clinical studies and the safety profile helping to further build trust in the effectiveness of the Divansi PCOS pack?
Yeah.
We certainly talk about it all over our website. We talk about it to all of our patients. But what has been your experience and kind of the confidence that you feel, of course, in the products as well, but also your patients feel, when you share the results with them?
Right, yeah. So, like, see, when we formulate a product, a medicine, we ensure that we only use herbs that are safe. So, essentially,
Right.
I had no doubts about the safety of the product. But then, it's a kind of standard thing where even a painkiller can damage your kidney and your liver, right? So
Yes.
we are all
Yes.
aware of it. So I thought it was important for us to establish that the primary organs which can get damaged because of a medicine, the kidney and the liver, is safe when I mean, the Divantri Assist and Divantri Flow do not cause any kind of damage to the kidney or the liver or any
Right.
other blood parameters, for instance. So
Right.
the trial actually included a very, very comprehensive study of all the blood parameters, and
Wow.
we also study the liver enzymes and the kidney. We do the liver function test and the kidney function test.
Okay.
So after giving them Divantri Assist and Flow for 120 days, we found that LH was 1 and FSH was 1.65, the ratio.
Wow.
Now, what actually happened here is the FSH increased and LH decreased.
Mm-hmm.
So this kind
Got
of
it.
helped in getting the ratio to fall into the required slot.
Right.
Whereas in standard of care,
Mm-hmm.
also FSH increased, but it only increased to 0.66.
Got it. Got
So
it.
it was
From
1 is to,
basically
yeah,
0.36. Okay,
yeah,
got it.
yeah. So from 0.36, it only increased to 0.66. Now this was the most important factor in reducing the number of cysts, reducing the size of the cyst, and also all our patients started showing normal menstrual cycle at the end of 120 days.
That's incredible. That's incredible.
Yeah.
To see 100% regularization of periods
Yeah.
after just 4 months is amazing.
Yeah, exactly. So they all started showing a regular menstrual cycle, and patients who were actually having Divan-3 assist and Divan-3 flow in the course of 4 months lost 8 kilos, which is like on an
Wow.
average 2 kilos per month.
That's amazing.
Yeah, yeah. And all these patients were also recommended lifestyle changes, like they were asked to go for a walk for at least half an hour every day, and they were recommended to not eat junk food and things like that.
Yep. Yep.
This was the case for both the arms, and in the standard of care, the patients lost 3 kilos in the course of 120 days.
Got it.
So the average weight loss. So these were the problems that, like I said, PCOS patients face, right? Weight loss was a huge challenge for them.
Absolutely.
And
Absolutely.
I mean, obviously the weight loss is because the hormones got normalized, and the hormones got normalized because of Divan-3 assist and Divan-3 flow.
That's
So,
incredible. So, I mean, I think first of all, considering all the rhetoric around, losing weight or Ozempic, this, that, everything, I think this points out very clearly that if you address the root cause of an issue, which in this case is the hormonal balance, especially of the hormones LH, FSH, it has all of these trickle down effects. Like,
Yeah.
for example, the cyst size number getting reduced, periods getting regularized, and this incredible weight loss, which actually the amazing part was they actually kept that weight off, which is the
Yeah.
hardest part with the condition.
Exactly.
I'd also like to point out one other thing that I remember you mentioning when we first discussed the trial, which was, and I was super excited by this as well, which was the fact that the rebalancing of these reproductive hormones also had really big implications on fertility. Um, so would love for you to share those outcomes as well, because
Right.
I thought that was a really beautiful aspect of the trial that we didn't expect.
Yeah. Actually, 3 of our patients conceived during the course of
That's
the trial.
amazing.
So in fact, they couldn't complete the trial, and I was like 3 patients short in my study when compared to standard of care. But these 3 of them conceived during the course of a study. I mean, of course, I don't know how many of them really did want to get pregnant when they came into the study, or they just came because they wanted to cure themselves of PCOS. Now, what happened in the standard of care is these patients are given contraceptive pills, and
Okay.
if they kind of say that they are planning to have a family, or they're planning to have children, then in that case they are given progesterone therapy.
Got it.
So so there were quite a few patients who actually did say that they would like they are thinking of starting a family. Unfortunately, we didn't have anybody who got pregnant in that category. So
Got it.
yeah. So it also goes to, and the study was done almost 2.5, 3 years back, and those 3 patients, I mean, the doctor told me that they had really healthy children and they're doing
I'm so
well.
happy to hear that. The
Yeah.
Durva Jummy stories are always happy. Durva Jummy babies are the
Yeah.
are happy babies. That
Right.
makes me very, very happy to hear. Um,
This established that absolutely no damage is caused to any of your organs, and your blood profile continues to be the same. And this actually does build a lot of trust in your patients, because there is this little hesitation when it comes to alternative medicine, where people say, oh, it damages kidney, it damages liver and things like that. Then we are able to tell them, no, we have data here that says that it doesn't do any
Exactly.
damage to, so it's extremely safe. So when I said, to establish safety of the medicine, we do all these tests. The liver function test, kidney function test, the blood parameters. And efficacy is with all these hormonal numbers.
Right. No, and that's data is gold, as they say today, right? Data is gold.
Yeah.
So
and it's done by a third party. It's not done by you.
Yeah.
Like
exactly.
It's done by a third party, collated by a third party. It's a CTRI registered trial, meaning this trial is registered in the clinical trial registry, and it's transparent. Anybody can go look up the registry and they will see your trial in there.
Absolutely, and that's information that we have shared on our website. We're going to share on our social media for anyone who is interested in that. I mean, it is information that is available to the public. That's why we do it in this way, so that no one is just feels like they don't have access to the information in any way, and that we've been very rigorous about how we've actually tested these products for the outcomes and the safety that we claim on them.
Exactly.
No, I think that's superb, and I think you've done such an incredible job of explaining the entire genesis and the thought process of the trials, our products, why they work so well. Obviously there's no better person to hear it from than the expert than themselves. So I think I really appreciate you being able to give such a deep dive into these products and our trials specifically. Before we leave, just one last question. You have a long legacy now in Ayurveda. The Jami group has 100+ year old legacy in Ayurveda, plus a very deep understanding in science, right? You come from a science background, a drug development background as well. You have probably seen a variety of different products in this space and adjacent spaces, across pharmaceuticals, across Ayurveda, across nutritional supplements. What makes Durva Life products different from others in the market?
So basically, these products are well thought out products. The formulation is made. If you see, there's lots and lots of ingredients in these products. It's not like you just say, okay, A, B, C is sufficient. No, every aspect of the particular disease or particular syndrome or the particular condition that you're addressing, every aspect is taken into account. Like I mentioned in assist. We know, like from our experience, we've not come across many people with diabetes when they have PCOS conditions, but we still took that into account because there's a lot of literature that says that they are prone to insulin resistance. So we have ingredients, herbs in our formulation that will address even insulin resistance. So that way, so when we make a formulation, we actually make a complete checklist of every aspect of that condition.
That's incredible.
Yeah, and then ensure that we have ingredients that address every single aspect, so that the problem is eliminated from the root. So we're not just looking to give you a mix of hormones. We're not giving you just estrogen or progesterone. No, we're not doing that. We are actually working to see that the body makes these hormones. The reason why these hormones got into the balance of these hormones was disrupted, we address that particular reason and make sure that when we correct it, it's corrected for good.
Yes. It's not a band-aid solution. I always say this, it's not a band-aid solution, it is a long-term solution because you're focusing on the root cause.
Exactly.
That's amazingly put, and I think I'd also like to add, most people don't approach formulations this way. You not only do this checklist and rigorous analysis of the literature, but you also go back and study the texts in the original Sanskrit as well. So you're about as close to the source material as you possibly can be, which is amazing. And I'd also like to add that all of our products are sourced with only using whole herbs. We don't use extracts. So that means that the exact interactions that you say will happen are expected to happen because we don't remove anything from that process, which is why we have so many ingredients, so many different aspects of the product addressing the whole systemic problem rather than just one single part of the problem.
Exactly.
Amazing. Thank you so much for your time, Dr. Anitha. Really, really appreciate it. I can say, despite knowing so much about the products and of course having heard all of this before, it's always amazing to hear it in so much depth and detail. And I know, all the folks that are listening will also really, really appreciate this insight. So thank you
Yeah,
so much. Thank you for your
it's been a
time.
pleasure. It's been a pleasure.